Assalamualaikum warahmatullahi wabarakatuh, and a very good morning to our respectable judges and fellow audiences. My name is Jamilah Sakinah Binti Jasin, and along with me is Muhammad Akmal with Ayob, and today we will be presenting our research entitled Comparison between Digital Panoramic Radiography and Cone Beam Computed Tomography in Measuring Presurgical Dental Implant Vertical Height at the posterior of mandible, supervised by Dr. Kherman Suparman and Dr. Nor Hidayah Reduwan. Our presentation today will be consist of background, problem statement, objective, methodology, results, discussion, conclusion, and also references. To start off with our research, a thorough presurgical implant assessment is one of the determinants that contribute to a successful dental implant placement. The assessment usually includes evaluation of trabecular bone dimension, quality, surface topography, and the relationship of proposed implant site to the anatomic structures such as nerve, blood vessels, adjacent tooth roots, nasal floor, and maxillary sinus. In order to achieve a long-term treatment success, Ayob et al. Mentioned that panoramic or pan-radiography and cone beam computed tomography or CBCT have been reported to be the most frequent imaging modalities that are available in the market for treatment planning of implant placement. Pan-radiography has been used as a gold standard for implant assessment for quite some time, as its main advantage is the ability to display body of the mandible and maxilla, mandibular canal that contains inferior alveolar nerve or IAN, and maxillary sinus in a single image. According to Hu et al., pan-radiography allows identification of suitable implant site, measurement of the residual bone height, determination of the length required, and mesodistal angulation of an implant for presurgical planning. As for CBCT, it is one of the advanced imaging modalities in the dental field that produce detailed and high-quality 3D images of hard tissue structures. Angelo Paulus et al. Reported that CBCT images enables clinicians to assess the bone as it can produce a clear 3D images of highly contrasted structures with corrected magnification, which will be helpful to obtain an accurate measurement in presurgical implant assessment. It also has lesser radiation dose as compared to conventional CT scan. Thus, this will reduce the radiation hazards as mentioned by Kumar et al. However, having said that, both have their own limitations, such as in panoramic radiography, it provides a horizontal and vertical plane magnification and also unable to display the existing bone width and their precise association with adjacent anatomical structures. While for CBCT, although it has more advantages in pre-implant assessment, it is not available in most dental clinics due to the cost, where it becomes a question whether pan-radiograph is adequate as pre-operative imaging modalities before proceeds with dental implant treatment. The problems that arise from these two imaging modalities will restrict the oral surgeon from performing an accurate presurgical implant assessment and lead to a wrong placement of the implant, followed by injury to the inferior alveolar nerve or IAN in the mandibular canal. According to Al-Juburi et al., there are 40% incidence of IAN injuries that cause serious complications to the patient, such as the nerve might be stretched, compressed, and partially or totally transected, which commonly resulted with temporary or permanent paraesthesia or anesthesia of the teeth, lower lip, or surrounding skin and mucosa. Despite what has just been said, Shahidi et al. Mentioned that an accurate alveolar bone height measurement and a safe margin distance from vital anatomical structures such as mandibular canal are important factors in dental implant placement for pre-surgical planning phase. Therefore, the objective of our study is to evaluate the reliability of pan-radiograph in comparison to CBCT images for posterior mandibular pre-implant assessment. Moving on to the methodology of the research, we have conducted a retrospective review of the PAN and CBCT images of posterior mandible that include inclusion and exclusion criteria in patients with fully or partially edentulous and dentate on 66 patients that consist of 19 male and 42 female for pre-surgical dental implant assessment between July 2016 and December 2020 at the Diagnostic Imaging Unit, Faculty of Dentistry, University Technology Mara, Sungai Buloh campus. The measurement was performed by dividing posterior of mandible into two segments, which are anterior and posterior of every obtained PAN and CBCT images. Anterior region was categorized from the mesial part of the first premolar to the distal segment of second premolar, while for posterior region was from mesial part of the first molar to the distal portion of the second molar. Then, average mesodistal coronal dimension from each region will be measured for both sides as a midpoint. I like to bring to your attention that in fully or partially edentulous patient, the location of the teeth will be simulated with respect to the location of the mental foramen. So, if one tooth is permanently missing at any of those regions, the midpoint will be obtained by dividing the total measurement from one part of the crown of available tooth to the nearest part of the crown of the tooth adjacent to the missing area, as you can see on the left side of the image. However, as shown on the right side, if more than two teeth were permanently lost at any anterior or posterior region without presence of teeth distal to the area, the measurement will be obtained by using standardized measurement of each region as reported by Mohd et al., which are 14.4 mm and 20.6 mm respectively, and mental foramen will be as a midpoint reference point. For measurement of vertical bone height, the reference point was established from the alveolar crest to the superior border of mandible canal. Therefore, the measurement will begin at the midpoint of total mesodistal coronal dimension of each region from the alveolar crest to the superior border of the mandibular canal. All measurements were independently performed by 3 observers that includes 2 dental students and 1 oral radiology specialist. It was done by measuring 3 times on each imaging modalities, and average readings will be calculated, and once the average readings were determined, mean difference in measurement between pen radiograph and CBCT for each patient were then calculated.
Bismillahirrahmanirrahim. Assalamualaikum warahmatullahi wabarakatuh, and a very good morning Ayob to everyone. My name is Akmal Munir bin Ayob, and I will continue with the remaining parts of the study. In our study, the most frequently observed gender was female, which made up 64% of the total samples, whereas Malay recorded the highest observed race with 88%. All 66 sets of pen and CBCT images were assessed in the study. In pen radiographs, the mean vertical bone height measurement at each region were higher as compared to CBCT images as shown in Table 1. Moving on to the next one. A two-tailed paired t-test were carried out to compare the mean difference between pen and CBCT images in measuring vertical bone height at the posterior of mandible. All the 4 regions yielded statistically significant difference in mean vertical bone height measurement between the 2 imaging modalities with a p-value less than 0.01. To assess the relationship between pen and CBCT images in measuring vertical bone height at posterior of mandible, a Pearson correlation coefficient was computed, and the results demonstrated a very perfect correlation between the 2 imaging modalities at each region, with the R value ranges between 0.86 to 0.92 with p-value less than 0.001. Agreement between 2 examiners, who were 1 undergraduate dental student and 1 oral and maxillofacial radiologist, in measuring vertical bone height at posterior of mandible using pen and CBCT were assessed using intra-class correlation coefficient (ICC). A two-way mixed effect model based on absolute agreement were assessed in the interactive reliability with 95% confidence intervals reported for each ICC. The results showed excellent agreement between the 2 inter-examiners with p-value less than 0.001. Now, moving on to discussion part. Our study found minimal difference between pen radiographs and CBCT images during the quantifying of vertical bone height from the alveolar crest to the superior border of mandibular canal. This is supported by a study from Ozab et al., where there was a range of 0.36 mm to 0.76 mm in average difference between pen radiographs and CBCT. Besides, comparison of the contralateral segment of the posterior mandible resulted in no significant difference in mean difference between pen and CBCT. This may indicate reliability of both pen and CBCT images in evaluating the respective contralateral segment of the mandible. Furthermore, a good prognosis dental implant should not interfere with the mandibular canal, where inferior alveolar nerve runs through. According to Vasquez et al., a safety margin of at least 2 mm between the tip of dental implant and the superior border of canal in pen radiographs is adequate to determine an adequate alveolar bone height prior to posterior mandibular implant insertion. Similarly, a study conducted by Gelak et al. Suggested, when using CBCT-based data for pre-implant surgery assessment, a safety zone of 1.7 mm should be taken into consideration. Correlating those studies to ours, when surgeons obtained the vertical bone height measurement from the alveolar crest to the superior border of mandibular canal, measurement should be deducted by 2 mm in panodographs and 1.7 mm in CBCT to avoid any injury to the nerve. In conclusion, the idea of sufficient information provided by panodographs for pre-surgical implant assessment in routine cases or when no CBCT is available at the clinics is supported by this study. The results from this study also suggest panodograph is a feasible and cost-effective imaging modalities with the added advantage of reduced radiation dose to the patient. However, currently, CBCT remains as the best imaging modalities for assessment for pre-surgical implant due to the reason that CBCT has minimal magnification errors. So these are our references. And with that, we thank you.